Hello, this is Dr. Lewerenz, Longevity Health Institute. Once again, I hope this finds you well, and I hope this informs you even better. So let's talk about the best in preventative medicine. What's the best way to prevent disease, reverse disease, and really overall improve your health and so you can thrive? And I'm talking about preventing cancer and even reoccurrent cancer. I'm talking about preventing heart disease. I'm talking about preventing immune issues and infections, including COVID-19 and other infections, like the flu, like respiratory conditions, allergies. I'm talking about preventing autoimmune disease, and literally the list is limitless, okay? It's taking a personalized functional medical approach because it's the way old school medicine used to be. And I'm gonna even tell you some details about how that has to happen and what approach you should take. So whether you see us here at Longevity Health Institute, me or my practitioners, and our growing practices in the southeastern Michigan, or people that literally do telemedicine now with us around the country and even other nations. Actually, I spoke with somebody about a week ago from Africa that found us through Facebook and through YouTube just for a consult so we could give them direction and things, because it's based on really looking at the root causes and not just, okay, you don't have a disease now, but about what we can do to really focus in and hone in on what is your issue, okay? So, but here's the thing is, how do you prevent? How do you prevent? Well, I'm gonna tell you two big systems, and I've covered these in other videos and other information that I've put out there, but I want you to hear this. Two major systems is your nutrient load, your vitamins in your body, your antioxidants in your body, and your gut health, which are all tied to essentially gut health, okay? 100% of my patients that come here for help with cancer, 100%, not less than that, have digestive issues, whether they know it or not. And some know it and they've just dealt with it, taking Zantac and taking, Prilosec and PPIs and dealing with heartburn and belching and IBS their whole life. And they've been told that's normal. That is not normal, and it can be functionally fixed. But you have to evaluate food allergies, leaky gut, food sensitivities, how you heal the wound of the gut, and you reduce histamines and inflammation and allergy reactions, and so that you can reintroduce foods potentially and eat a normal choice of food and sources and variety. But you got to fix the underlying issue first. 70% or more of your whole immune response happens at your digestive gut barrier. So you want to prevent cancer, you want to prevent disease, you want to prevent and reverse some of your previous issues. You got to work on your diet and you got to work on your gut health, which starts simply with a little bit of self-care and self-love. You got to fix yourself to love yourself and love others, and to spread the message and spread good things in your life and be there for friends and family, right? So, but you got to fix the gut, okay? And you got to pay attention to this. This is huge. Even in my cancer patients, how we keep them well and how we actually can show objectively in their labs improve immune issues is by fixing their gut health and fixing their diet and optimizing how they methylate, how they detoxify. But it all starts at the gut, okay? The other thing I see a lot with disease is that is stress and immune issues. Stress and immune issues are huge. When you're stressed, you cause adrenal cortisol issues, you don't sleep. Studies show the reduction in sleep and disruption in sleep causes tons of immune issues. It's linked to cancer. So you have to address whatever is causing your stress. Honestly address it, hit it at the root cause, and how can you balance your adrenals, sleep better, and be healthier from that autonomic stress response system. But first of all, it has to be appreciated, right? So again, all cancers, and I'm telling you, tons of disease, including heart disease, is very linked to stress and bad diet, inflammation, and it all starts in the gut and actually in your adrenal stress responses and sleep, because it's a big stress immune effect. The other thing is that here we've done wonderful things with patients for prevention of COVID-19 and infections in general, okay? I firmly believe in our protocols of high dose vitamin D, vitamin C, zinc, quercetin, probiotics, vitamin A, curcumin, okay? And again, the basics, the foundation, gut health, low adrenals, you gotta fix them, sleeping good, okay? IV vitamin C. IV vitamin C, IV nutrients. We do them here preventatively all the time. When we have infections here, they last our patients a quarter or a third of the time, okay? 2, 3 days, 3, 4, 5 days, okay? When they're doing these types of therapies and they're addressing their functional medical foundation, okay? I've already had here in May and June and a little bit of July some telemedicine visits that we've done with our patients that have had and diagnosed objectively with COVID-19, okay? Because we were doing some of these immune approaches and because we were optimizing their immune system and some of them were getting IV vitamins, etc., okay? What happened? They had very short sequelae of infection and symptoms related to being positive, okay? So these things work. They're real, okay? They're out there, they're very effective, okay? But you gotta hit at the root cause and take a personalized functional approach to your health, self-care, self-love, okay? And take it for real and take yourself literally to a better, healthy place by really looking at root causes and root things. Now, of course, we always use traditional medicine when needed, but if we can fix the foundation and fix some of these systems, you don't need that. You don't need therapies, you don't need drugs, okay? And when we have to use them, we usually use them very limited and short term so that we can then work on reversing disease, okay? And essentially, it gets us a better quality of life and overall better health. And 99% of the people feel better. So they don't just get healthier, they feel better. In fact, I had a patient today that I did a consult with on telemedicine because she lives a few hours away, and she stopped some of her supplements and she stopped her hormones and she stopped her iron, something super simple you've heard me talk about because her iron was low in the past. She absorbs iron poorly. And she's like, well, I feel back to, she's about 55, how I was feeling before. And again, I didn't realize how good I was feeling doing some of these things and balancing my hormones and taking the right nutrients and eating appropriately. And she goes, 3-4 years ago, I was feeling better than I did in my 20s. Better than she did in her 20s when she was in her 50s. Think about that. That's amazing. But again, she has to just get back on the horse and get back on the right track and kind of live appropriately. But again, because it's treating the health foundation, and it starts at hormones and gut health and nutrients and sleeping well and balancing your immune system. And this can be done actually pretty simply, but it's got to be looked at appropriately first. So hopefully this is insightful. It comes from the heart and it comes from objectively here in the office. We see me and my wonderful practitioners, my staff here that help us every day, help people every day, and get great results, okay? And we're here for you. If you need a phone consult, if you need a new patient visit in person or by telemedicine, often people have to wait a few months to see myself. I always get involved in cases though, and I supervise everything. But we're happy here and my practitioners to see you as soon as possible and get you in, and we take new patients every day. I think today we saw 3 new patients in one of our offices, and I'm sure more at the other. But we are happy to help, excited to be a part of your health journey and to get you better. So visit us here at Longevity Health Institute. Follow us on longevityhealthinstituteinc.com on Facebook and YouTube. Please subscribe and share this with loved ones and others. This is Dr. Lewerenz. Be well.